Hi friends, welcome back once again for the last session on module 4 about computer tomography CT safety. So we will continue with the dose reduction techniques in CT. So last session we have already discussed about automatic tube current modulation. So we'll continue with the other dose reduction techniques which involve FOV and filters. What is FOV? Field of view. We have two types of field of views. One is scan field of view and the other one is the display field of view. So scan field of view is nothing but when we start imaging we are keeping an FOV. For example, brain, we are keeping an FOV from base of the skull to the vertex. So that is the region that we are actually covering. So a display field of view is nothing but during that particular brain imaging, if you want to get cut section from the orbit or paranasal sinus or any other part within that region, that the brain region that we are already covering, so there you can keep an additional display field of view with changing the window width, window level, filter. You can keep a separate display field of view, so it will be reconstructed and getting the image. So accident cases, trauma cases, if it's required, both brain as well as orbit, paranasal sinus, facial bone, everything, if you want to get it done, so you keep a bigger FOV to cover entire brain and face, then keep smaller FOVs, display field of view, to acquire all the organs or parts to be imaged. So you don't require to image or expose multiple times the patient. You will have only one exposure and you will get the other reconstructed images. So always choose the smallest FOV that is prescribed, because we can reduce the radiation dose. So which possible for the body part being examined, you have to try to use the smaller FOVs. Also use appropriate filters provided by the vendors. So specifically we are using bow tie filters, so which can reduce skin dose approximately 50%. So you can see the shape of the bow tie filter. At the periphery you can see it is thicker and at the center it is thinner. So that is nothing but that is according to our body or the object. You can see from the image the object. So at the center you can see that the travel for the radiation, it is too high, means large area it has to be covered, so there is thinner filter. But at the periphery, if you go, the travel for the radiation is too less, so we are using a thicker filter at the edges. So that is what the shape of this particular bow tie filter is designed in that way, to reduce the dose significantly. Rotation time also having a significant role in radiation dose. In CT imaging, tube rotation time and radiation doses are directly proportional. So doubling the gantry rotation time, for example from 0.5 to 1 second, doubles the total patient dose, that is the MAS. While halving that rotation time reduces the dose by half. So faster rotation reduces the motion, but shorter times requires higher MA to maintain image quality. So rotation time is related to dose in a linear fashion. So shorter rotation time advantages linear decrease in radiation dose, faster scan time, less motion breathing artifact. Use shorter rotation time for pediatric patients, and also subconscious patients you can use shorter rotation time to avoid movements in the patient. Also, there is a disadvantage which is about the tube life. If you are continuously using the shorter rotation time, the tube life may decrease. The next one is overranging. That is nothing but Z over scanning. That is nothing but the scan length is automatically extended beyond the planned image boundaries. We have already kept an FOV, so it will go the first few section and the last few section will be overscanned. That phenomenon is known as overranging. To reconstruct, this is particularly to reconstruct the first and last section of the helical CT scan. That is what the scanner automatically extend beyond the planned image boundaries at the top and at the bottom. So overranging increases the patient dose. So we can use specific collimators. Nowadays every vendors are providing different collimators, means same collimators only but with different names. Each vendors have different technologies. So Eclipse dose right collimator blocks unnecessary overranging at the start and end of all helical scans. So the company Philips, the vendor Philips is calling Eclipse dose right collimator. Other Siemens, GE and Toshiba, which are using adaptive dose shield, dynamic z-axis tracking and active collimator respectively. So with different name but the purpose is one. And you can see the over scanning in this picture, the red area which is getting this both the bottom and at the top level, it is getting overexposed. So to reduce this, we are using this kind of advanced collimator to reduce the radiation dose. So we'll move on to the patient centering. So don't be hurry, don't position the patient hurry-burriedly. So take the time to position the patient in ISO center. You will get better image quality and speed up your post-processing times. So use different tilt position when scanning, particularly the head. For sinus and facial bone, tilt the chin little bit up so it will be appropriately positioned. Also brain and petrous bone, tilt chin bit down to avoid orbits and reduce the scan volume, directly reducing DLP and dose, making sure the patient is flat in the Z plane, as this gives optimal dose modulation and image quality. It also reduces potential high skin doses. So take the time to position the patient in the ISO center. Don't do it for the namesake. Use different tilt position when scanning the head. Inaccurate centering degrades the image quality and increases the dose to the patient. Improper centering can lead to increase in the surface dose and peripheral dose to the patient. So always make the patient at the ISO center. There are some modern technologies. Sometimes some bariatric patients, very heavy patient, it is very difficult to move the patient from the table to the lateral sides. Specifically if you want to image at the shoulder or any side of the body, so it will be difficult to make the patient move, specifically bariatric patient. So such patient, we have now many technologies. That is one technology which is called tech assist lateral slide. What is that? Which enables lateral coach movement of around 8.4 centimeter from side to side. So you can move the patient without moving the patient. You can just move the table in the lateral aspects. So patients that are not properly centered, do not have their center of mass properly aligned with the center of the bow tie filter, which affects the attenuation of the X-ray beam and image noise. We can use this tech assist lateral slide. So you can easily move with the remote or with the button. You can move the patient side by side by moving the coach. Here we have to just remember that the scanner is not a human. Scanner is just a CT scanner. So in the picture A, you can see I have put cross marks. So above the isocenter, if we position the patient above the isocenter, what happens? The scanner will assume that a bigger or heavier or bariatric patient is within me. So what will happen after doing the topogram or scanogram with the above isocenter patient? What happens? The scanner will automatically set a KVP and MAS according to the patient size. So above isocenter if we keep, scanner will assume it is a heavier patient. So technical factors will be higher. So excessive dose will be getting for that patient. On the third C, you can see we are keeping below the isocenter. What happens? The scanner will assume that it is a thin patient. So it will give very less dose. What happens? it will cause excessive radiation to the patient, because low dose will absorb, will not penetrate and go, it will be absorbed. So that patient also will be getting more absorption dose. So to avoid that, we have to position the patient in a ISO center, so we'll get an optimum dose to the patient with a good clarity picture. Next, we will talk about bismuth shielding, a non-lead radio-opaque latex-based material used to reduce the radiation dose approximately 30 to 50% to superficial radiosensitive organ like the eye, thyroid, and breast. So it has been shown to reduce radiation dose to skin and superficial organs without compromising image quality. That is what the advantage while comparing with the other shielding such as lead and all, and reduce primary beam attenuation too. A study was conducted by Yilmaz et al. In 2007, long ago. Bismuth shielding reduces breast dose by 40.53% with no significant image degradation. So that is what the first article you can see about the bismuth shield used to reduce unwanted radiation to the breast without degrading image quality. So its further investigations have showed that it can reduce the dose to breast from 43 to 73% for a thorax CT investigation. What all are the breast shielding protocol? Shield placement. Top of shield is placed on sternal notch to cover the breasts. Also, shield is positioned after scout have been performed. So topogram should be performed, then only we have to keep the shield, because it should not affect the automatic tube current modulation. As I mentioned, we are keeping above the isocenter and below the isocenter. Similar way, if we are keeping a shield bismuth, even though if it is bismuth, there are some kind of attenuation is there, isn't it? That is what we are using it as a shield. So if you are keeping in topogram itself, what will happen? Because of that attenuation, the automatic tube current modulation will fail. So to avoid that, modulation does not incorporate the shield into its MA calculation. So that's why you are avoiding shielding before topogram. So once you have positioned the patient and topogram is done, then you can keep the shield for the helical scan. So not only for the adult breast, we can use it for pediatric breast shielding, also thyroid and eye shielding. We are commonly using this bismuth shield. Further techniques to reduce the radiation dose, which involves low dose in follow-up scans. As I mentioned in previous session, we will be having continuous exposure for particular patient who have been admitted in patient department. Many patients are admitted, so those patients will come for multiple times for a CT investigation. So avoid unnecessary exposure to the patient. This is an investigation which is performed in a standard protocol and in a reduced dose protocol in a follow-up scan after 8 days. So you can see the CTDI volume, you can see 10.9 milligray the CTDI volume, and reduces the dose protocol. You can see the difference in the dose, that is around 4.8 milligray, significantly reduced. Half the dose have been reduced, but you cannot see much variation in the image quality, but it is acceptable. So reduce the radiation dose for all the follow-up scans. So educating have a significant role in reducing the radiation dose. So we have to educate such as referring physicians and patients about the radiation exposure. Also, it can occur through lectures, printed material for physician and patients, access to institutional and societal website, individual consultations by radiologists, etc. Also, more important justification, attempt to reduce dose adhere to the as low as reasonably achievable ALARA principle. Steps to be sure the examination is justified include exam is truly clinically indicated. It should be justified. It should have a positive benefit. So exams has not been performed recently at another location as the patient. Okay. And an alternative imaging examination such as ultrasound or MRI is available, particularly in pediatric and pregnant patients. We can able to utilize those modalities instead of giving excessive radiation. Thank you one and all once again. We'll see you in the next session.